All right, we're going to do a lecture on schizophrenia here. Um, if depression is a common cold of psychological disorders, schizophrenia would be considered the cancer. Um, that's because schizophrenia is one of the most devastating mental illnesses that there is, and you'll see why as we start to go over the symptomology of schizophrenia. Nearly 1% um, of the population suffers from schizophrenia, right around 1% in any given year. And schizophrenia strikes young people as they mature into adults. So, anywhere from the age of around 17 to the mid 20s is the most diagnosable ages of schizophrenia. So, um, that's about the time when most people would be diagnosed as schizophrenic. Men and women get schizophrenia at an equal rate. However, when they do have it, men have more severe symptomology than women do. The symptoms of schizophrenia can be put into kind of three categories. One is disorganized and delusional thinking, the other is disturbed perceptions, and lastly, inappropriate emotions and actions. We'll talk about each of these individually in the next few slides. What you see here is a quote um, that, or just a statement that you might see a typical person with schizophrenia making. You can see their their speech is very disorganized. There's some delusions there, thinking they're Mary Poppins. Um, there, there just isn't a typical flow of speech within this quote. This is very typical of what you would see from a person with schizophrenia. There's some other types of delusions that people with schizophrenia have. One is delusions of persecution, where they think someone's out to get them, they're out to harm them. And the other is delusions of grandeur, where they think that they are a king or a god, or that they can do some sort of miraculous actions. These are two very common forms of delusions in a schizophrenic person. A lot of psychologists think that schizophrenia is um, comes from a failure in selective attention. If you'll remember earlier in the year, we talked about selective attention, where if you're in a group setting and you have a bunch of people talking, but you're in a private conversation, you can block out all the other information in the room. You can block out other people talking. You can block out the noise of music or whatever, and that's kind of in the back of your mind. And you can speak to the person and listen to them and interact with them. One theory says that in a schizophrenic person that they don't have the selective attention, and all the stimuli in an environment hits them equally at the same time. So you can imagine how difficult it would be to stay sane if you have all of that information coming at you at once. So that's one theory where they just can't filter out information. Disturbed perceptions are another symptom of schizophrenia, where people perceive things that are not there. Hallucinations are very common amongst schizophrenic people. Um, the most common are um, auditory hallucinations, where they hear things. They might hear voices telling them that they're no good, or voices telling them to do something, sometimes to harm themselves or others. And then, to a lesser degree, you have hallucinations of vision or touch or smell or taste. Any of the five senses can have hallucinations. Again, it's the auditory that is the primary hallucination for most people with schizophrenia. Sometimes with people with schizophrenia, they will have inappropriate emotions. They might laugh at the news of someone dying, or they may show no emotion at all. Or patients with schizophrenia may continually rub an arm or play with their hair or rock in a chair, some movement all the time. Or they may go the complete opposite route and be catatonic, where they don't move for minutes or hours at a time. That's called catatonic schizophrenia. Okay, one thing that you need to understand is there are positive and negative symptoms of schizophrenia. Now, I don't want you to think of positive and negative as good and bad. I want you to think of positive symptoms as symptoms that are present that shouldn't be there, and negative as symptoms that aren't there that should be there. So positive symptoms, things that are there that shouldn't be, such as hallucinations, disorganized thinking, um, and things like that. Movements that would be inappropriate or at least not normal. These are things that are present in a person with schizophrenia that is not typical or normal. Negative symptoms will be things that aren't there that we wish were there. So apathy, a lack of caring. We wish they would care more. Not showing expressions, not showing emotion, where typically a person can express emotions. Very rigid body or lack of movement. We wish they could move. So things that aren't there that should be there are called negative symptoms. So that's positive symptoms and negative symptoms of schizophrenia. Chronic schizophrenia is when the disease comes on slowly and progresses slowly, and this tends to be a more serious type of schizophrenia where people have a harder time overcoming it, or have a harder time with it being treated successfully. Whereas acute schizophrenia tends to develop more rapidly, and people usually show positive symptoms in this, and they're able to deal with those positive symptoms a lot more effectively than they're able to deal with the negative symptoms. Just for the fact that it's easier to get somebody to get rid of something that they have than it is to make them do something that they don't have. Such as if a person doesn't care, if they're apathetic, it's hard to get them to be empathetic. It's hard to get them to care. But you can help someone with positive symptoms kind of get rid of those positive symptoms. And usually that's done through medication and therapy. There are different types of schizophrenia. These are subtypes of schizophrenia. They're catatonic, paranoid, residual, disorganized, and undifferentiated. And let's look at what that means. Paranoid schizophrenia, we've kind of talked about, where they're preoccupied with delusions of persecution, where they think people are out to get them. Disorganized schizophrenia is where their speech is very disorganized, or their speech is very flat, or that they have inappropriate emotions, such as laughing at the news of a funeral or news of someone dying. Those are things that we would see in disorganized schizophrenia. Catatonic schizophrenia is where they're immobile, kind of like statues. One of my old professors in graduate school talked about when he was a student, they were making rounds in a hospital, and he saw one of his classmates who had been told not to mess with the people that were catatonic. One of his classmates went and waved a finger in a guy's face, and the guy grabbed his arm, came out of the catatonic state, grabbed his arm, and bit the guy's finger off. So, catatonic schizophrenia is where they're typically immobile, or in their speech, they're just parroting what you speak, what you say, or copying your movements. Undifferentiated is just varied symptoms of schizophrenia, where they kind of have a lot of symptoms, and you're going to see that in a video that I show you. And then residual is just withdrawal after hallucinations and delusions have disappeared. So those are your different subtypes of schizophrenia. Just understanding where how people get schizophrenia. Most researchers believe it is an overactivity of dopamine in the system. There's higher levels of dopamine on the D4 receptors in the brain. You don't necessarily have to remember that, but you just need to know that there is there's overactive activity with dopamine in the brain. A lot of times there's atrophy in the brain. You can see that here is a normal brain, no schizophrenia. It's all the brain structures seem to be in place. Here, see that this is filled with fluid, this dark spot. See how it's bigger than in this one. Also, look, there's some atrophy here, and here this has gotten a little bigger. So the brain has kind of started to deteriorate a little bit, and that is typical of a brain from someone with schizophrenia. Another theory about schizophrenia is that it is caused by a virus from that it's been contracted when you are in your fetal stage of development before you're born. So that is that's another observation about how we get schizophrenia. Now, there's definitely a genetic factor in schizophrenia. If you have an identical twin who is schizophrenic, then you have a 50% chance yourself of being schizophrenic. You can just kind of look down this chart. If you have a sibling that has schizophrenia, you're probably a little less than 10% chance of getting it. So you can tell there is absolutely a genetic marker for schizophrenia. And this is just about a family, just reiterating the fact that schizophrenia is most definitely genetic. That there are this is a genetically identical sisters suffering from schizophrenia, and two of them have schizophrenia and two of them don't. And what you need to gather from all of this is that schizophrenia is both genetic and environmental. And most likely what the cause is that people are born with a genetic marker for schizophrenia, and through things in the environment, such as maybe a fetal virus, or maybe even trauma in the person's life, those genetic markers can be turned on, and they might then develop schizophrenia. So you might have the marker for schizophrenia in your genetic makeup and never become schizophrenic. Early warning signs of schizophrenia, and this will be our last slide. A mother's long-lasting schizophrenia, birth complications, oxygen deprivation, low birth weight, or prenatal viruses would go in there. A short attention span and poor muscle coordination, disruptive and withdrawn behavior in childhood, emotional unpredictability, poor peer relations, and just solo play, just playing by yourself and not with peers. All of these things would be things that we would look at as warning signs of schizophrenia. Of course, um, they're not absolutes. You could have these things and not have schizophrenia, but it would raise our awareness of someone who um, might eventually develop schizophrenia. So that's schizophrenia, and next time we will talk about personality disorders and how they relate to The Simpsons. So look forward to that. But for now, watch this, and I'm glad you've watched it. Go back, take notes as you need to, and I will see you in class.